Hey everybody. So we're going to continue talking about holistic health and how it differs from allopathic medicine or conventional medicine. Okay, so again, in the US, we're spending about $3 trillion a year on allopathic medicine. The Institute of Medicine estimates that about one third of that is wasted in unnecessary treatments and wasteful practices. A lot of doctors admit to practicing what they refer to as defensive medicine, which is ordering unnecessary tests or procedures to avoid being sued. A lot of times, also, patients will come in and request a specific drug because they saw it on a commercial, and doctors will just, rather than arguing with the patient, just prescribe the drug, um, primarily because they don't want to lose the business. This is what we're spending our money on. So you can see that over 50% of our money is spent on keeping hospitals running and paying physician salaries. Again, we mentioned before that prescription drugs represent about 10% of our total healthcare spending. If you look at the slice in the right, public health is only 3%, and obviously I'm biased because that's my field. But if we spend a little bit more money on public health, educating people about preventative medicine, we could probably cut back on that $3 trillion that we're spending every year. We spend far more money on medicine than any other country in the world. We're almost double the country that comes in number two. I think Canada is number two. And yet we rank 27th in life expectancy and 51st in infant mortality rate. Now these numbers, they look pretty bad. They are pretty bad. It's primarily due to health disparities, the fact that not everyone has access to the healthcare system. Um, so the World Health Organization ranks the U.S. healthcare system at 37th in the world. So, you keep hearing about how the U.S. has the best healthcare system in the world. That's simply not true, not by any means. There are some areas that we are very good at. We have by far the best emergency medicine in the world. We have the best diagnostic systems, MRIs, things like that. We're very, very good at um, for acute care, things like surgeries or treating bacterial infections. If you have a bacterial infection, by all means, take an antibiotic. If you have a tumor that needs to be removed, absolutely go to an allopathic physician, no question. Any type of emergency, you can feel confident while you're in the ambulance, God forbid, that you are getting the best care in the world. Um, Most people assume that medicine is based on evidence, on scientifically validated procedures, but that's simply not true. Evidence-based medicine is a relatively new concept. Only about 20% of medical procedures are actually based in evidence. Um, and what the evidence does say is that diet, exercise, and stress management techniques are actually as effective or more effective than many of the treatments that are being used. Exercise is as effective or more effective than any of the treatments being used for cardiovascular disease, other than a heart attack. If you're having a heart attack, obviously you don't want to just walk that off, right? You need to go to the emergency care. But when you're diagnosed with cardiovascular disease, exercise is far better than any drug that they can give you. You should probably take the drug as well, but you need to get on an exercise program. Exercise is also better than any antidepressant in the treatment of depression. Same thing for anxiety. And then when you combine diet with that, there really is no allopathic treatment that works as well. When we're talking about preventative medicine in allopathic terms, generally we're talking about vaccination or screening for disease. And both of those things are important. I certainly don't want to dismiss those. But allopathic physicians do not train in nutrition. This is a well-known problem that most medical schools do not offer sufficient training in nutrition. They don't really talk about stress management very much. They might tell you that you should learn how to manage your stress, but they don't give you any tips or don't give you any advice. And they really don't study the effects of medicine, or excuse me, that exercise can have as a medicine. What they do rely on quite heavily is prescription drugs. About two-thirds of doctor visits result in the prescribing of at least one drug. And as a result, use of prescription drugs has increased by about 25% just in the last decade alone. 70% of the U.S. population is on one prescription drug. 50% of the population is on 2 or more prescription drugs, and a subset of the population, I think it's 20%, is on 5 or more drugs. So we use a lot of prescription drugs in this country. The Institute of Medicine estimates that over 100,000 people a year die from the fatal interaction from properly prescribed prescription drugs. Okay, that's not medical errors. That's people taking their drugs in accordance with their doctor's recommendations. 100,000 people a year. Another somewhere between 100 and 200,000 people a year die from medical errors. No one knows exactly what that number is because we rely on hospitals to self-report when someone dies from a medical error. So no one knows exactly what that number is. The estimates vary from somewhere between 100 and 200,000 people. And 100,000 people a year die from hospital-acquired infections. So you go into a hospital to get some type of surgery or some type of treatment. You pick up an infection that had nothing to do with why you went into that hospital in the first place, and then you end up dying from that infection. So when you combine those three things, the medical system is the third leading cause of death in the United States. Illicit use of prescription drugs is now second to marijuana as the most abused drugs in the U.S. Primarily prescription opiates, Oxycontin, things like that. Those are by far the most abused drugs in the United States. More overdose deaths are caused by prescription drugs than all other illegal drugs combined. Pardon me. So, there's a big debate right now over, the use of medical marijuana or recreational marijuana. Obviously, there's always been a big war on drugs, crack cocaine, heroin, methamphetamine. And I'm certainly not advocating the use of any of these drugs, but prescription drugs get overlooked quite frequently. And they are by far the biggest problem in the United States. One of the biggest differences between holistic health and allopathic medicine is the approach to symptom treatment. So allopathic medicine tends to use pharmacology or surgery to treat the symptoms of disease, and holistic health tries to understand what's going on that is causing these symptoms. So this is a concept that comes from Chinese medicine. It's called the root and the branch. So the root is the underlying cause, the root cause, and the symptom is the branch. So oftentimes we seek relief for these symptoms. We take a pill, or if you're using alternative medicine, you use an herb or an acupuncture or a chiropractor to treat the symptom without really understanding that root cause. And that's really what we attempt to do in holistic health. And we treat symptoms as teachers. So these symptoms are warning signs that something isn't quite right, and we need to make some changes in our lifestyle choices to correct these symptoms. So they act as teaching tools to help us live a more balanced life. So some symptoms of illness: anxiety, depression, loneliness, headaches. Migraines are a terrible problem for a lot of people. Oftentimes it's something in the diet that triggers those migraines, or it could be a stress-related incident that triggers those headaches. Same thing with anxiety, depression. We'll talk about different stressors that can contribute to anxiety and depression. A lot of times diet can contribute to depression. Lack of exercise can contribute to depression. Back pain, any type of muscular pain is, again, a symptom. Again, we can use, when you're talking about holistic health, you can use certain things that can treat that back pain. Acupuncture is wonderful for back pain, but we want to understand what's going on. Why is that back pain happening in the first place? Same thing with rashes. A lot of times you'll take a steroid or something like that to clear up a rash, but you want to understand what is causing that rash in the first place. Irregular function, whether you're talking about constipation or something like PMS. Again, usually those things are related to diet. Not always. There could be some other contributing factors, but we want to understand the root cause rather than just take a drug or an herb or something else that's just going to relieve that function. Inability to concentrate, obviously a big problem. It often gets diagnosed as ADD or ADHD. Inability to concentrate is a symptom. There are a lot of potential causes for that, and there are a lot of natural treatments to treat the inability to concentrate. We'll talk about that when we talk about ADHD. People that are accident prone, that could be a lot of different things. Could be potentially an inner ear issue where they just have a loss of balance, overall low energy. Again, that's another epidemic in our culture that we don't talk about. That's why Starbucks does so well, right? So, um, if you don't have enough energy to get throughout the day, to get everything done throughout the day that you need to, if you hit a wall at 3 o'clock, whatever it is, you need a cup of coffee or a candy bar. That's a symptom that something might not be, that something is a little bit off. So again, the idea of the patient as a participant in the healing process. So again, rather than simply treating the symptom of disease without without addressing the underlying cause, holistic health requires that the patient actually becomes a participant in the healing process. So it's an education process. The patient learns to adopt certain lifestyle choices that will address and correct that underlying root cause. So yes, we will treat the symptom, whatever it is, but we want to address that underlying root cause, whether it's something in the diet, potentially, something in the environment, some type of a stressor, maybe a lack of exercise or too much exercise or the wrong type of exercise. All these things could potentially be an underlying cause. We discourage the use of or the concept of the magic bullet, which will cure disease. At least once a semester, somebody asks me, is there some herb or something like that that will cure cancer? People ask a lot about acupuncture. Will acupuncture cure cancer? That what they're referring to is a magic bullet. We're not going to simply replace pharmacology or surgery with an herb or an acupuncture needle that's going to cure that disease without addressing the underlying root cause. Um, there are some things that can work. Again, when I talked about acupuncture for back pain, there's some really great herbs out there that can relieve a lot of these symptoms, where they were talking about rashes. There's some herbs that are very helpful for depression. But rather than being dependent on that herb or that acupuncturist or the chiropractor or the massage therapist, whatever it is, we want to understand what that underlying root cause is and hopefully work that out. So again, another main difference between allopathic medicine and holistic health is that allopathic medicine is based in what we refer to as scientific materialism. So if you take a look at this, this line to the far left is scientific materialism. So it's atheistic, and science is atheistic. It's the rejection of any type of spiritual influences on health. Okay, so that's the far left. And then the far right would be religious fundamentalism. So the rejection of science and anything other than a particular religious belief. So people that would fall under that far right, the religious fundamentalism, would be folks that refuse to get medical care. They believe that only prayer can heal. And there's been a couple pretty well publicized cases recently in the media about people that refused to get medical care for their children, and the children ended up dying as a result for something that was completely treatable with medicine, modern medicine. So that's an example of the far right. Again, the far left would be a complete rejection of any type of alternative medicine. And where we are is somewhere in the middle. And that's where I think most people really are. Holistic health, we perfectly understand and accept the some of the benefits of modern medicine. We're not going to reject modern medicine. We're not going to reject pharmacology. We're not going to reject surgery. But when we can, we're going to use diet, exercise, religious, spiritual practices to help contribute to the overall well-being of our body, our mind, and our spirit. So allopathic medicine, again, is based in scientific materialism. It's a very mechanistic viewpoint of medicine. It's like the body is a machine, and any disease is a malfunction of a physical part that needs to be corrected with through biochemistry, through pharmacology. Non-physical influences are generally not considered. Holistic health involves the health and harmony of the entire body, mind, and spirit. The body has an innate tendency to heal itself. It has a natural ability to heal itself. Disease, and I hyphenated that, dis-ease, that's literally where that term comes from. It means that the body is not at ease. So the body is not at ease when we don't take care of it properly. So dis-ease occurs when the mind-body is out of balance. And it can manifest as an almost infinite number of symptoms, some of which we already discussed. And this is kind of a funny cartoon I like. This is actually a doctor forwarded this to me, a doctor that I know that's very big in preventative or lifestyle medicine. So preventative medicine kills return business. So this is what they learned in the first day of medical school. Obviously, this is an exaggeration. Again, doctors, nurses, they can talk all day long to a patient about how they need to eat healthy and how they need to exercise, and the patient just nods their head and just wants the drug. So this is a cultural problem. This is not necessarily entirely on the fault of the medical system, but this is the difference between allopathic medicine and holistic health. Holistic health focuses on preventative medicine so that we can avoid going to the doctor as much as possible, obviously, except for things like screening programs or vaccination programs. Okay, I hope this was helpful. I hope you enjoyed this.